This is KTVO's Good Morning Heartland.
And we're talking about heart disease because February is American Heart Month, and heart disease is still the #1 killer. It affects more women than men and is more deadly than all forms of cancers combined. So the question is, how does somebody know they're at risk? And once again, we have Dr. Margaret Wilson here this morning to break it down for us. How are you doing today?
Good morning, Ella. Fine.
Good, good. Thanks for coming on. So when it comes to a heart attack, are the symptoms different for men and women?
Yes, often symptoms are different for women. You know, when we think of heart disease, we typically think of men, but really women are at risk, and probably even more women than men. And often the symptoms are different how they present. We think of the chest pain as being the symptom to watch for. With women, sometimes it's a little more subtle. They may have some chest pain, they may have some discomfort in their chest, or even things like upper abdominal pain, nausea, dizziness, and interestingly, sometimes sleep disorders. Another big one is fatigue. So unexplained fatigue, maybe with exertion, would be something that would be suspicious.
All right, and what are some questions that a patient should be asking their doctor?
Well, I think it's important just to, get regular checkups and ask about, what's my blood pressure, what's my cholesterol, what can I do better to reduce any risk of any kind of heart disease.
So we just touched base on the symptoms that women should look out for. So if we can just pop those up on the screen. You had just said chest discomfort in upper body area, shortness of breath, and cold sweats or lightheaded. So if a woman is experiencing any of these symptoms, what should they do about it?
They definitely should go see their doctor or healthcare provider and get evaluated. These kind of symptoms, again, can kind of sneak up on them, and any suggestion of something just not right, they should get in and get checked out.
Okay, and what are some ways, I guess my other question is ways to prevent it? Are there anything that you can prevent your risk of heart disease?
I mean, know your risk factors. If you're a smoker, you definitely need to try to quit. Smoking is a big risk factor. High cholesterol and definitely is a high risk factor. Know your blood pressure. Try to get your blood pressure under control. Eat a healthy diet. Exercise, all those things are going to reduce your risk.
All right. And for those that might have, other health conditions, does that increase their risk?
Certainly, particularly things like diabetes.
Okay.
So if you're diabetic, you're going to be at high risk of heart disease. So again, very important to keep that under control. If you're overweight, obesity is another disease that can impact and increase the risk of heart disease. So obviously things like exercise, diet. A low-salt diet is very helpful. It'll keep your blood pressure lower and hopefully, again, reduce your risk.
Okay. Is there any other tips you'd like to give our viewers out there?
Well, again, just if you're a woman, know that heart disease is something you need to be thinking about. We tend to worry about cancer, and certainly that's important, but you need to take care of your heart and make sure you get a checkup.
All right. And then if you do experience any of these symptoms, don't take them lightly. Don't think that maybe because you're tired, that you're feeling fatigue or anything. It might be even something more serious, as in a possible heart attack.
Right, absolutely. Get in there and get checked out, because you never know. And many women don't have symptoms, or at least don't recognize the symptoms until they have a major issue.
All right. Well, thank you so much for your time. And what we'll do is we'll post all of this information on our website at heartlandconnection.com, and we'll be right back.